8 warning signs of kidney problems you must not ignore. In today's video, we're diving deep into something super important: kidney health. You may not realize it, but your kidneys are silently working around the clock to keep your body balanced, healthy, and functioning. But here's the thing: kidney problems don't always show up with obvious signs, especially in the early stages. And that's exactly why it's so important to know the warning signs that could indicate something's wrong with your kidneys. We're talking about symptoms you might be ignoring that could actually be early signs of kidney issues that need immediate attention. Did you know that by the time kidney problems become noticeable, they can already be in an advanced stage? Yep, kidney disease can be sneaky. That's why today we're going to cover 8 warning signs of kidney problems you must not ignore. From changes in your urine to difficulty breathing, we're going to break it all down so you can be proactive about your health. We'll look at things like frequent urination, swelling, fatigue, and even unexpected nausea. These could be more than just minor inconveniences. They could be a cry for help from your kidneys. If you're experiencing any of these symptoms, it's so important to take them seriously. Early detection is key when it comes to kidney health, and I'm here to help you understand what your body might be telling you. So stick around, because this could make all the difference for your kidney health, and it might just save your life. If you're ready to learn about these 8 warning signs, smash that like button, subscribe if you haven't already, and let's get started. Number 1. Frequent urination, especially at night. One of the earliest and most noticeable signs of kidney problems is frequent urination, particularly at night, a condition known as nocturia. While it's completely normal to need to urinate a couple of times a day, if you find yourself running to the bathroom more often than usual, especially during the night, it might be a signal that your kidneys are struggling. Your kidneys are responsible for filtering waste and excess fluid from your blood, and when they're functioning properly, they control how much urine your body produces. However, if your kidneys are damaged or not working efficiently, they may not be able to concentrate urine properly, leading to increased urination. Frequent nighttime urination can be more than just a minor inconvenience. It could indicate that your kidneys are having trouble filtering out waste and that fluid retention is occurring in your body. When kidneys are impaired, they may fail to reabsorb excess fluid, and it might get stored in your system, leading to an increased urge to urinate. Additionally, diabetes and high blood pressure, 2 common culprits of kidney problems, can contribute to nocturia, making it a key warning sign to watch out for. But it's not just about the volume of urine. If the quality changes as well, such as having foamy or cloudy urine, that can be a red flag that your kidneys aren't filtering properly. If you experience nocturia, you may also notice that it disrupts your sleep, leaving you feeling tired, sluggish, and even irritable during the day. This repeated pattern of waking up at night to urinate is something that should not be ignored, especially if it continues over time. If you're experiencing this, it's a good idea to consult a healthcare professional for further tests and evaluations, as early detection of kidney issues can make all the difference in preventing serious kidney damage. So don't brush off those late-night bathroom trips. They could be trying to tell you something important about your kidney health. Number 2. Swelling in legs, ankles, or feet. Swelling in the legs, ankles, or feet is another major red flag when it comes to kidney health. If you've noticed that your lower extremities seem to swell up, especially by the end of the day, it might be a sign that your kidneys are struggling to do their job. Normally, your kidneys filter out excess fluid and waste from your bloodstream, maintaining a delicate balance of fluids and electrolytes. But when your kidneys aren't functioning properly, they can't get rid of this excess fluid, causing it to build up in your body, particularly in the areas that are furthest from your heart, like your legs and feet. This condition, called edema, often manifests as puffy, swollen skin and can make your legs feel heavy or stiff. What makes this symptom so concerning is that it's often gradual, which means many people don't notice it right away. At first, the swelling might be subtle, but over time it can become more pronounced, especially after standing or sitting for long periods. The swelling may also come and go, but if it becomes persistent or worsens, it's a clear sign that something is amiss. In addition to kidney issues, edema can also be linked to heart disease, liver problems, or venous insufficiency. But when combined with other kidney symptoms like frequent urination, fatigue, or changes in appetite, it's crucial to pay attention. When kidneys fail to eliminate extra fluid, it's not just about the swelling. This retention can also lead to high blood pressure, which, in turn, puts more strain on the kidneys, creating a vicious cycle. Edema can even cause discomfort or pain in the swollen areas, making it hard to walk or put on shoes. If the swelling is severe, it could also result in tight, stretched skin or skin discoloration, both signs that fluid retention is becoming significant. If you're experiencing any kind of swelling in your legs, ankles, or feet that doesn't go away with elevation or after a good night's sleep, it's time to see a doctor. Early intervention can help prevent further kidney damage, improve your quality of life, and even save you from more serious complications down the road. So, don't ignore those swollen feet. They could be trying to tell you something about your kidney health. Number 3. Fatigue and weakness. Fatigue and weakness are some of the most common and often overlooked symptoms of kidney problems. If you're constantly feeling tired, drained, or just lacking energy, even after a full night's sleep, your kidneys could be trying to send you a warning signal. Here's why. Your kidneys are responsible for filtering waste and excess toxins from your blood, and when they're functioning properly, they ensure your body stays balanced and free from harmful substances. But when your kidneys begin to fail or become compromised, the waste products build up in your bloodstream, leaving you feeling sluggish, weak, and generally unwell. This toxicity in the blood interferes with your body's normal processes, making even simple daily tasks feel like monumental challenges. As kidney function declines, your body also struggles to maintain proper levels of red blood cells due to a reduction in erythropoietin, a hormone produced by the kidneys that stimulates red blood cell production in the bone marrow. This leads to anemia, a condition where you don't have enough healthy red blood cells to carry oxygen throughout your body. Without adequate oxygen supply, it's no wonder you feel exhausted, breathless, and fatigued. Additionally, kidney disease can also disrupt the balance of electrolytes and fluid in your body, causing further physical weakness. Low calcium levels, in particular, which can occur in kidney disease, contribute to muscle weakness and cramping. It's not uncommon for people with kidney issues to also report feeling mentally foggy, having trouble focusing or concentrating, as if their brain is as tired as their body. This chronic tiredness and weakness can severely impact your quality of life, making it harder to enjoy daily activities or even get out of bed in the morning. What makes this symptom tricky is that many of us attribute fatigue to simple exhaustion, poor sleep, or stress, brushing it off as something temporary. However, when fatigue becomes persistent or worsens, especially when accompanied by other kidney signs like swelling, frequent urination, or nausea, it's a warning sign that shouldn't be ignored. If you've been feeling unusually tired for weeks or months, even with adequate rest, it's time to consult a healthcare professional. Catching kidney problems early can make all the difference in preserving kidney function and improving your overall health. So, don't dismiss that constant fatigue. It might be your body telling you that your kidneys need attention. Number 4. Persistent pain in the lower back or side. Persistent pain in the lower back or side, especially around the area of your kidneys, is one of the clearest and most concerning signs of kidney problems. This type of pain, often described as a dull ache or a sharp stabbing sensation, is different from the usual back pain that most people experience due to muscle strain or poor posture. The kidneys are located on either side of your spine, just below the rib cage, so any pain in this region could indicate a potential issue with these vital organs. When kidney problems arise, the pain typically comes from the inflammation, infection, or swelling of the kidneys. Conditions like kidney infections, pyelonephritis, or kidney stones can trigger sharp or cramping pain in the lower back or sides. The pain from kidney infections is often accompanied by other symptoms, such as fever, nausea, and painful urination. Kidney stones, which are solid mineral deposits that form inside the kidneys, can cause excruciating cramping pain that radiates from your lower back to your groin area as the stones move or get stuck in the urinary tract. Sometimes, kidney pain can also be associated with hydronephrosis, a condition where there is a buildup of urine in the kidneys due to a blockage, such as a stone or other obstruction. The pressure from the accumulated fluid causes the kidney to swell, leading to discomfort or sharp pain. If left untreated, these conditions can worsen over time and cause irreversible kidney damage. That's why persistent pain in this area, especially if it doesn't go away with rest or basic pain relievers, should never be ignored. It's important to note that kidney pain is often different from muscle pain. If you press gently on the area where the kidneys are located, the pain may become more intense or tender. In contrast, muscle or skeletal pain is usually more evenly distributed and can be alleviated with changes in posture or movement. This is why it's important to know the difference between the two. If you're experiencing persistent pain in the lower back or side, combined with other symptoms like swelling, blood in the urine, or changes in urination, it's crucial to seek medical attention right away. Early detection and intervention can help prevent kidney problems from escalating into something more serious, potentially saving you from chronic kidney disease or even kidney failure in the future. So don't wait for the pain to worsen. Take action now to protect your kidneys and your health. Number 5. Changes in urine color or consistency. If you've ever noticed that your urine looks different than usual, whether it's a change in color or consistency, it's something you should definitely pay attention to. The appearance of your urine can be a window into your overall health, and changes in its color or consistency can point to underlying kidney problems. Under normal conditions, urine should be a pale yellow or amber color, clear without any cloudiness, and with a fairly consistent flow. However, when your kidneys aren't functioning properly, these characteristics can change in significant ways, often signaling potential issues that need immediate attention. One of the first signs of kidney problems is dark, reddish, or pink urine, which can indicate the presence of blood. This condition, called hematuria, could be caused by kidney stones, urinary tract infections, or even kidney disease. If you notice that your urine looks like it's tinged with blood, it's crucial to seek medical attention immediately. Blood in the urine can be a serious sign of something wrong in the urinary system or kidneys, and it's important to catch it early before it leads to more severe complications. Another change to be aware of is cloudy urine, which could be a sign of an infection or the presence of pus. Cloudy urine may also be accompanied by a strong, unpleasant odor, both of which are classic symptoms of kidney infections, pyelonephritis. Infections can lead to pain, fever, and difficulty urinating, and if left untreated, they can cause permanent kidney damage. If you notice these changes in your urine, it's time to schedule a visit to your doctor to rule out any infections or other kidney issues. Consistency changes, like foamy urine, could indicate an excess amount of protein in the urine, a condition known as proteinuria. This is often one of the first signs of chronic kidney disease, CKD. Normally, the kidneys filter out waste and retain protein, but if they are damaged, they may allow protein to leak into the urine. If you see foam or bubbles that don't dissipate quickly, it could be an early warning sign of kidney damage, and a simple test can determine if there's abnormal protein in your urine. Urine that is too light, almost clear, or very dark, almost brown, might also indicate issues. Very clear urine can sometimes be a sign of overhydration or kidney problems, where your kidneys are struggling to concentrate urine, while extremely dark urine can indicate dehydration or a more severe kidney issue. If you notice any of these changes in the color or consistency of your urine, especially if accompanied by other symptoms like painful urination, swelling, or fatigue, it's important not to brush it off. These changes can serve as an early warning system for kidney dysfunction or disease, and addressing the issue early can significantly improve outcomes. Pay attention to what your body is telling you, and don't hesitate to reach out to a healthcare professional for a proper diagnosis and treatment. Your kidneys are telling you something. Don't ignore it. Number 6. High blood pressure. High blood pressure, or hypertension, is one of the most significant and insidious signs of kidney problems, and it often acts as both a cause and a consequence of kidney disease. Kidneys and blood pressure have a symbiotic relationship. Your kidneys help regulate your blood pressure by managing the balance of fluids and electrolytes, and when they're healthy, they release hormones that help control blood vessel function. However, when the kidneys are compromised due to disease or damage, they can no longer effectively regulate fluid balance or sodium levels, leading to fluid retention and an increase in blood volume, which naturally raises blood pressure. On the flip side, chronic high blood pressure can also damage the kidneys over time. The high pressure in your blood vessels can cause scarring and thickening of the small blood vessels in the kidneys, called glomeruli, making it harder for them to filter waste properly. This damage, over time, can lead to kidney failure, which is why hypertension and kidney disease often go hand in hand. In fact, it's not uncommon for kidney disease to develop in people who have had high blood pressure for years, but the symptoms can be silent at first, making it harder to detect. What makes high blood pressure particularly dangerous for kidney health is that the effects are often gradual and may not show any immediate noticeable symptoms. You might feel fine day to day, but inside your kidneys and blood vessels are under constant stress. Over time, this can cause the kidneys to lose their ability to filter waste, regulate electrolytes, and maintain fluid balance, leading to a vicious cycle. As the kidneys struggle to function, blood pressure continues to rise, which further exacerbates kidney damage. Another key point is that high blood pressure can lead to proteinuria, the presence of excess protein in the urine, one of the earliest indicators of kidney damage. So it's critical to monitor your blood pressure regularly, especially if you have any risk factors like a family history of kidney disease, diabetes, or cardiovascular problems. Lifestyle changes like reducing salt intake, limiting alcohol, exercising regularly, and managing stress can all help keep your blood pressure in check. But for those with existing kidney problems, medications may also be necessary. The bottom line is that high blood pressure is a double-edged sword when it comes to kidney health. It's both a potential cause and a result of kidney damage, and its presence often signals that something is going wrong with your kidneys. If left unchecked, it can progress to chronic kidney disease or even kidney failure, but early detection and management can slow down or even prevent further damage. If you're experiencing high blood pressure, especially along with other symptoms like fatigue, swelling, or changes in urine, don't wait. Make an appointment with a healthcare professional. Taking action now can save your kidneys and your health in the long run. Number 7. Nausea, vomiting, and loss of appetite. Nausea, vomiting, and loss of appetite are 3 symptoms that are often overlooked or dismissed as being related to something as simple as a stomach bug or stress. However, when these symptoms persist, especially in combination with other signs, they could be serious indicators of kidney problems, particularly as the kidneys begin to fail. These symptoms occur when the kidneys are no longer able to properly filter out toxins and waste products from the blood. As a result, uremia, a condition where waste builds up in the bloodstream, can develop, leading to a variety of gastrointestinal symptoms, including nausea and vomiting. One of the main reasons nausea and vomiting are so common in kidney dysfunction is because when the kidneys fail to filter waste efficiently, toxins such as urea accumulate in the blood. This buildup can irritate the gastrointestinal system, causing discomfort, nausea, and even vomiting. In fact, this nausea can become so severe in advanced kidney disease that it can result in a complete lack of appetite. The body, overwhelmed by waste accumulation, may not feel the desire to eat, or even when food is consumed, it may quickly be rejected through vomiting. For many people, a loss of appetite in the context of kidney disease can have a ripple effect. Eating less leads to weight loss, further weakening the body and impairing its ability to fight illness. This creates a cycle where the body lacks the nutrients it needs, making the kidneys work even harder, which in turn makes the symptoms of nausea, vomiting, and loss of appetite even worse. In severe cases, people with kidney failure may experience extreme dehydration due to frequent vomiting and decreased food intake, compounding the issues and worsening their kidney function. Another reason nausea and vomiting are linked to kidney problems is electrolyte imbalances. The kidneys play a crucial role in regulating the levels of essential electrolytes like sodium, potassium, and calcium in the body. When kidney function declines, these electrolytes can become imbalanced, leading to symptoms like nausea, vomiting, and muscle weakness. The body's inability to regulate fluid levels can also lead to edema, or swelling, further complicating the picture and intensifying discomfort. It's important to note that nausea, vomiting, and loss of appetite in the early stages of kidney disease may not always be noticeable. These symptoms can be subtle and may come and go, making them easy to dismiss. However, if you notice that these issues are becoming more frequent or persistent, especially if you're also experiencing other symptoms like fatigue, swelling, or changes in urine, this could be a sign that your kidneys are struggling and need immediate attention. Left unchecked, these symptoms could worsen and lead to chronic kidney disease or kidney failure, so it's crucial to take them seriously. If you're experiencing any combination of these symptoms, especially over a prolonged period, make sure to consult a healthcare professional for a thorough evaluation. Remember, your kidneys are responsible for filtering out waste, maintaining hydration, and balancing your electrolytes. When they aren't functioning properly, the entire body can begin to suffer, and nausea, vomiting, and a loss of appetite are some of the first signs. Catching kidney problems early can make all the difference, so don't ignore these symptoms. Your kidneys need your attention before the problem becomes more serious. Number 8. Shortness of breath or difficulty breathing. Shortness of breath or difficulty breathing might seem like a simple issue related to exercise, allergies, or even a cold, but when it occurs without any clear cause or worsens over time, it can be an important sign of underlying kidney problems. This symptom often goes hand in hand with kidney dysfunction, especially in its later stages, and can manifest in ways that may be alarming if you don't know what to look for. So, how exactly are kidneys and breathing connected? When kidney function begins to decline, the body starts to retain excess fluid due to the kidney's inability to properly filter and excrete waste. This fluid buildup can have a direct impact on your lungs, as it accumulates in various parts of the body, including the lungs themselves. Pulmonary edema, or fluid in the lungs, can make it difficult for you to breathe, causing a sensation of shortness of breath, especially when lying down. This condition is one of the most serious complications of kidney failure and requires immediate medical attention. People with kidney disease may feel breathless even with the smallest exertion, or they may experience a tight chest or a feeling of suffocating when lying flat, known as orthopnea. Moreover, difficulty breathing can also be linked to anemia, a common condition in those with kidney disease. When the kidneys fail to produce enough of the hormone erythropoietin, which stimulates the production of red blood cells, anemia can develop, reducing the amount of oxygen that is carried throughout your body. As a result, your heart and lungs have to work harder to make up for this lack of oxygen, leading to feelings of fatigue and shortness of breath. People with severe anemia may find themselves getting winded just by walking up a flight of stairs or even performing basic tasks. In addition to fluid retention and anemia, kidney disease can also cause an electrolyte imbalance, which can further affect your breathing. When potassium levels become too high, a condition called hyperkalemia, it can disrupt the normal electrical signals in your heart and muscles, including the respiratory muscles. This can lead to an irregular breathing pattern or even breathing difficulties as your muscles and organs struggle to function properly. Shortness of breath or difficulty breathing can also be a result of high blood pressure, which often accompanies kidney disease. When blood pressure is uncontrolled for long periods, it can cause damage to the heart and lungs, making it harder for them to pump blood effectively. As the heart works harder to push blood through blocked vessels or damaged kidneys, it might not be able to keep up, leading to pulmonary congestion and respiratory issues. While it might seem like a minor inconvenience, difficulty breathing can be a red flag for kidney problems that shouldn't be ignored. If you're experiencing breathlessness that doesn't seem to be caused by something like exercise or a temporary illness, or if you're noticing that it's becoming more frequent, especially when lying down, it's essential to consult a healthcare provider. Timely intervention can prevent the situation from escalating into more severe kidney or heart complications. Remember, your kidneys play a vital role not just in waste filtration, but also in regulating your body's fluid balance, blood pressure, and overall oxygen levels. If they begin to fail, the effects can ripple across your entire system, causing symptoms like shortness of breath that are often mistakenly attributed to other causes. Don't wait to getting checked out early is your best chance at preventing further damage and ensuring your kidneys remain healthy. Summary. Alright friends, that's a wrap. We've covered the 8 warning signs of kidney problems that you absolutely must not ignore. From frequent urination and swelling to fatigue, nausea, and even shortness of breath, we've discussed how crucial it is to listen to your body and catch these symptoms early. Remember, kidney health is something that often goes unnoticed until it's too late, so being aware can make a huge difference in your well-being. If you learned something valuable today, please give this video a thumbs up. It helps spread the word and keeps us creating more content to help you live a healthier life. But beyond just watching videos, if you're experiencing any of these symptoms, don't wait. Early detection is key when it comes to kidney problems, and getting checked out by a healthcare professional could be the most important decision for your health. If you're not sure where to start, go ahead and book an appointment with your doctor or a kidney specialist. The sooner you take action, the better the chances of preventing further damage. Your kidneys are your body's filtration system. They deserve the best care possible. Thank you so much for joining me today. I hope this video empowers you to take better care of your kidney health and stay informed about the warning signs. If you enjoyed the content, don't forget to subscribe if you haven't already. That way you'll stay up to date with all our future health tips and life-saving information. I'd love to hear from you in the comments below. Have you noticed any of these symptoms yourself? Or do you have questions about kidney health? Drop them down below and let's talk. I always love hearing from you and connecting with this amazing community. Until next time, stay healthy, stay informed, and keep taking care of your body, especially your kidneys. See you in the next video.